Hey everyone, welcome to the Healthcare Digital Marketing Podcast. I'm super excited about having Dr. Ginger on this episode. She has a lot of experience, especially as a dentist, but then now really focusing on helping dental practices be more profitable and, physicians in the medical space to operate profitable practices through, keeping patients, but also attracting new patients. And so now you're doing that full time. Is that right, Dr. Ginger?
Yeah, my story, I started off, as you said, as a dentist for a long time. And I went through a really rough period in my practice and trying to figure it out. And everyone told me just be a better dentist and business would grow. And, being on the other side of it, that's the worst advice in the world. And you probably understand that too in your experience. But, when you're when you're there, that's what you believe because that's what they told you. And so, marketing played a big role in that for me and making it happen. So I was dabbling my toes for many years in helping practices because people were asking me to reach out and help them, and then also doing practicing myself. But for, at least the last 11 plus years, I have done this exclusively because that's my focus.
Wow, that's awesome. That's awesome. And you've also been featured on some major publications, Dental Economics, Dental Products Report, and many others. So you're definitely doing amazing things in the dental space, in the medical community. So I guess for you, how did you take that next step, right? Like, how did you go from a dentist practicing many years to, moving towards a marketing expert?
Well, I mean, again, it's back to that necessity. That was not my intention. It wasn't my business plan once upon a time. All my life, that's all I wanted to be, was a dentist. You can ask me when I was 5, and that was my one and only career every time you ask me. So, I
Wow.
streamlined through it all. I wanted to be a dentist and get through it. And I purchased my first practice right out of dental school. In fact, before I got out of dental school, my senior year, we made the deal. I said, the old dentist was sitting there, keep it open, keep it running. When I get my diploma and my license, I'll be here. And I knew that practice was in bad shape. I had no reservations about it, and I wasn't misled. I knew it was in bad shape, but my take on it was because it was him. He didn't have this fancy dental degree, and he didn't have this fancy education. And I'm bright and shiny little new penny coming in there, and I'm just going to change everything overnight, and it's going to be perfect. So I just need him out of there. And, reality didn't change. It didn't matter who was in it. It was the business that was the issue. It wasn't the dentistry. It was how the business was being run. And so I had to develop that, and, went about building a business the wrong way, like a lot of people do. Got a lot of CE, bought a lot of equipment, built a brand new, beautiful office, and all I did is jacked up my overhead and still made the same amount of money. So that was not the way to build a business. I can tell you all the ways not to do it. And so, when I figured out, one, to get my head in the right place, what am I doing? I'm here to serve people, but that wasn't coming across. I wasn't talking their language. I was talking like a dentist. And, when I could talk to them and they could understand what I was really trying to do for them, and when I was listening to what they really wanted, we were on the same page, but we were talking a different language.
Right.
So that's where, marketing message match came in for me. And I became a really good student of marketing, and turned that practice around for where I was struggling for years, turned it around in just a few months to where it was profitable.
Wow.
So that's where I got it. Is people said, like you, how did you do that? And I would tell them. And so my CPA asked me one day, could you do that for another practice? And I said, well, yeah. He says, there's nothing special about your office, your location. You didn't have this magic insurance comes in that pays 110,000% more than what you charge. And I'm like, no. And I was like, what are you saying? I was getting a little upset with him. And he was like, because I need to know if this can work somewhere else. And I said, yeah.
Right.
And he said, then show me. I've got some people that need some help. And that's how that all just kind of organically came about.
Wow, that's awesome. And so when it comes to marketing, so now that you transition to more of that marketing consultant expert, where do you find that you have, I guess, the biggest strengths really as it relates to marketing? Because when someone says marketing, right, they're like,
Yeah.
is that radio? Is that TV? Is that Google? What is that? So just would love to open up on that topic.
Well, sure. And when it comes to marketing, most people are, like you said, they're looking for a silver bullet. What do I need to do? Tell me what thing I need to buy, how much to spend, and where to put it. And that is the farthest thing from marketing, because that can't succeed unless you know how to talk to these people, who your best customers are, who you're going after, and you're speaking their language, their wants, their desires, their needs. I'm going to do whatever I need to do to get in front of them in whatever medium I need. So if they're listening to the radio, I'm going to put on radio. But if they only get their mail and that's the only thing they do because they live out in the middle of nowhere, which was a big part of my practice, we're going to do more mail. And it was a communication. So marketing, it's not a tool. That's what I don't call it. I don't call it
Yeah.
something you go off and do. Marketing is it's a relationship. That's, I guess, what we really need to call it. It's not something I do to somebody. It's something I do for somebody. And it's not communication, because that's usually one way. It's a relationship. So where can I open the door to have that conversation where we can find out what's going on in their heads and what they really want?
Right. That's awesome. And to that point, the relationship is key, and then just solving a problem, right?
Right.
If you can solve that problem, whatever that oral issue is or that medical issue, but also communicate where the audience is, that's super important. Because like you said, if they're not listening to radio, or they're not, watching much TV in that area, and you're spending 10 grand, 20 grand on TV radio ads, then you're going to spend a lot and have a lot of expenses, and not as many new patients. So I think, to your point, it's so critical to be where they are and connecting with their pain points.
Right. Well, go back into solving the problem too. The way in dentistry, they beat your common language out of you. You've got to talk like a doctor. I want you to use a professional tone. Give me the diagnosis. And so, just this morning, and I took a screenshot of it. It was an advertisement, came up on Instagram, and it was for a laser facility. And so I looked at it. I was like, I don't know if they're local, if this is national. And I see anything marketing, I'll start digging a little deeper. So I clicked the button to see what the ad was. And they asked me, was I looking for, and I'm going to make up this because it was Greek to me, Thermalodge. Was I looking for IPL? Botox, I recognize that word. Juvederm, I know that word because of all the advertising, but 9 out of the 10 things that they said, that was the first step. So I had to go about and diagnose myself first before I could go further, when they could have asked me in common words, are you worried about fine lines? Do you have dark spots? Are you looking for hair removal? Those things I know. Right. And so that's why when we as professionals need to use their language, I mean, that's the first thing on a website. I tell my doctors, don't put all, veneers, endodontics, whatever. Say, are you here to get, what's the 4 things that people are calling you about? I want to get my teeth clean. Okay. That's one button. I don't like the way my teeth look. Done. I got crooked teeth. Done. And a lot of them that do cosmetic procedures, I don't like the wrinkles or fine lines. Okay. Those are those words that they're calling you about. That's what you need to be talking first, right out of the bat.
Right. No, that's awesome, because now you're really connecting with them when they're just looking at a screen, right? Like they don't know, like if it's a new patient, especially, they don't know anything about your practice besides the reviews, what you have on the website. But if you're connecting with those pain points, I'm sure with your experience, you've seen very common questions or common, just language that when a new patient calls, you see a lot of these same questions, like how much is teeth cleaning or whitening or whatever that language is. And so I think that's so important. And when you think about new patients, to that point of, you're kind of going down that Instagram story, when you think about new patients, have you seen a shift or anything that's really changed with how to attract new patients for doctors?
Well, after COVID, I think a lot of people are in the world where they want to automate everything. We have all these shiny bells and whistles, but it still comes back to that communication. So if, another doctor's office, we're trying to make that initial contact with them. Well, they had contacted us. The number they gave me didn't work. So we were calling back, and we got on their website, and they had a request form. So we put it in there and say, hey, I'm just following up with you, the phone number you gave. So the first problem, your website phone number doesn't work. Bad. So don't tell me about you getting new patients. You've got that going on. So we filled out the communication. I really, thought by the end of the day, let me tell you, it's been 3 weeks and I still haven't heard from them. And I doubt they even got that. So where did that go? So, you're talking about Instagram, you're talking about all these, it's still got to be timely. And they usually want to talk to a person. Sometimes they want information. You can do that. You can give them information. Most of the time, if I've got a direct question, we're small enough. We are not Amazons of the world. This is where we thrive. This is our sweet spot. So we've got to be human. And like you said, those questions are coming in. You can sit there and just record every question that comes in a day. and ask, how many times does someone ask for how much is a cleaning, or how, I want a cleaning. Where doctors,
Right.
I was trained, well, when they ask for cleaning, we should educate them. Well, it's not really, it's a cleaning. It depends if you have a healthy mouth or a diseased mouth. If it's a healthy mouth, it's a prophylaxis. If it's a diseased mouth, it's a scale and root plane. They don't care. It doesn't matter.
Right.
I just talked them out of it. They're like, thank you, and hung up and
Right.
went somewhere else.
Right. Yeah, it's to your point of like the earlier conversation of just common language. Like it's so key based on the, the constant and consistent information you're hearing from patients who are calling, but also your existing patients, right? You can learn a lot from them. What's your take on live chat? So to your point of just being able to, be responsive in a fast way to answer questions. Like, have you been opposed or pro live chat on a website?
Any form of communication. So they're on internet, they're on live chat, they're DMing you. I always want to try to get that as quickly as I can, as naturally as can to one of these, because it's verbal volleyball back and forth. Keyboard confidence. They're saying all kinds of things they probably wouldn't say to you and to your face. Say, that's a good question. There's so much I need to ask you about that. Is it okay? Is there a number I can give you a call at? And we can get this resolved. So I always try to transfer into that human relationship, because again, it's back to that connection.
Right. And it's nothing like just getting on the phone to talk with someone, right? And you feel you have more confidence with the, the answers that you're given. And then to that point, it's, if your front desk is really good at, the relationship driven aspect, then they can schedule that appointment. Live chat, it may be more challenging where they're talking to a bot or they're talking to someone who's not even in the office, and they don't like, it's hard to, book that appointment.
Right.
Because it's just almost just like, the persuasion of influence is just being able to hear someone, get the answers that you're asking for, and then, take that next action step. And so to your point of getting them on the phone, I think that's so critical. If they're missing those calls, right? Like, I can only imagine what conversions are like in most dental practices, that if they would just answer the phone or call people back
right
to get those people in the office as new patients, I'm sure a lot more would be profitable as well.
Well, we're talking about, you answer the phone. It amazes me how many offices still don't have somebody answer the phone live at lunchtime, their normal business hours. Or they will, someone will leave a message. They will not call them back till the end of the day. That's too long. Nobody answers. Everyone should answer the phone on Friday. I don't care if you work half a day or you don't work at all. There should be someone live answering the phone. Those are normal things. And I think COVID has shown us that the people who are better at customer relationships and keeping that connection, because these people had emergencies, were like, what do I need to do? I don't know how many offices we contacted who had contacted us first that said, because of COVID, we're closed. You still can answer the phone. You still can talk to people. That's your biggest asset, not that handpiece and your CERAC machine. It's these people, and you need to keep that really connected, because they're going to call the next person.
Yep, exactly. So to that point of really, as a like what you've done, right? You went from, operating your own practice, and then you really looked at the marketing side to make it profitable, and many other things, I'm sure. But when it comes to, running a practice, how much time and energy would you recommend any dentist or doctor to be involved in the marketing strategies?
I think they should always keep their toe in it. I know there's agencies that can do it, but it's your voice, is your relationship. Nobody can replace you. We call, I tell my clients, it's mule work and magic. So 20% of that is magic, but 80% of that's mule work. But you got to keep your toe in that 20% and going forward. Or, you can have a key person in the office who is still the voice for the office. What do you guys stand for? What's important to you? What's your personality? Because, I personally can't name too many unethical dentists. But if you ask patients out there, they'd say there's a lot of them. And it's just because it's miscommunication. I know dentists really, really, really care. That's genuine. and going forward. But people are choosing you or not choosing you based on things that are outside of that scope. So the canter of your voice, what's important to you, you're standing in the community. If your spouse is involved in something in the community where your kids go to school, they're looking for that connection to somebody they know. And so, if we're dealing with the local market, you're not treating people across the country. They need to see and hear you. So nobody, and even me as another dentist, could not go into your practice and capture your voice. So you've got to keep that little toe in there.
Right. No, that's awesome. And, to that point, I think, what I see a lot of the time is how much they are involved, but also having a point person, if they are working with a marketing agency, to really be connected, or the liaison between the doctor and then the marketing group. Because the doctor's practicing most of the time, right? So
if things are going right, that's what you should be doing.
Yeah. Exactly. And then just, I think about it, at the level of conversions, right? Like, it doesn't matter how much money you throw at, marketing or mailers or whatever that is. If you can't convert those leads, you're going to struggle and be wasting a lot of money. So we see this a lot of time with like fee for service practices, because if they're throwing, marketing dollars out and the language is not congruent to what, is happening based on, what insurances they take, and, the type of patient they're trying to go after, when that person calls and the first thing they hear is, hey, do you accept this insurance? Nope. Okay, I'm going to hang up and call the next person. So I think that's so important. But back to the conversion conversation, is having a point person to really, track every lead that comes in, new patients specifically, and then also making sure you understand why you're converting and then why you are not converting, so that you can maximize that marketing dollar. Like, what's your take on just really, we work with 34 dental practices, right? And I would say half of them have a point person, half of them don't. And so,
and you know which ones are doing better and which ones are not right now by that, don't you?
Oh yeah. Exactly. So how do you, like, if you let's say you're working with a dentist, right? And did you recommend them finding a point person to really help with the marketing conversions? Like, what's your strategy on just conversion in general with new patients?
Well, first I always like to define marketing, what the role of marketing is. What role of marketing is to get the phone to ring or to get a click and get to that level. Now, the conversion part is as you're talking about, once I get them in the office, the marketing's done its job. So it's up to the internal of the office. So that's a systems problem, a management system problem. So, are we, people, for instance, I'll give you an example. This is what's in my head right now. I have someone who's like, I need a bunch of new patients. And then when I pulled back the curtain, she has no openings for a new patient for a month. So no, nobody's going to wait that long. So what we went back to there. That's what we started. The fastest path to cash was what's already in the office. Let's clean up where you can get a new patient in a timely manner. We can see them more efficiently. The answer is more often, yes, we can get you taken care of. More same day dentistry, because they were not seeing people. They'd see them 2 months later, and then they put them out another 2 months. That's nothing to be proud of. It's about getting stuff done. So that has to be cleaned up first before I said you can spend anything on marketing, because I always say, you gave me the wrong patients. They're horrible patients. I couldn't convert them. And I said, no, let me go back and look at it. And then as to the point person question, every office has to have that liaison. So it might be someone already on staff. And usually when I'm talking to the doctor, I'll go through and I will tease that out. And usually I can find maybe a dental assistant who's really good at that we could give that role part-time to. Try not to give it the office manager, because they're already strapped. But is there somebody else in the front office that can spend a little time on that and be a point person? But when I come to marketing persons, it's a personality thing. It's a different animal. So they might be great with people, but when they're a marketing person, they've got to be attention to detail. They've got to have high follow through, and I will go through and I'll test them for that. And I'll tell them, doctor, I love Mary. Keep her with you next to the patients, because she will not thrive in that role. She will not be a star in there, and you're going to be mad, and Mary's going to be frustrated. So let's go and find somebody else, or let's hire a part-time person, and we will find somebody to do this, but this is not right for them. And that's what's make or break for me, is that marketing assistant.
Oh, that's awesome. I think that's critical. Just being able to have, because what you're talking about is practice management. it's not just the marketing, right?
No,
Because if
they
you don't
go.
have the, yeah, hand in hand. I agree. Oh, totally agree. So, so we talked about, language and overall messaging, marketing, but to make a practice very attractive, right? Because I'm sure you see this. There's a dentist on every corner,
Yep.
and so, like, how do you stand out? How do you make your practice more attractive for new patients?
Well, I think again is back to being yourself. So we talk a lot about video, and I'm not talking about polished, high studio, let me put my suit and tie on kind of thing.
Yeah,
This is where your social media comes in. You are a member of the community. So they can hear your cadence, they can find out about people in your staff. There's questions that come in every day. So that's an easy one to use for video. So I will tell them at least once a week, they have a set day that they will answer questions. So like, what's a crown?
yeah,
And you have to answer it in the simplest terms. So they have to practice this for a while until they get used to it. And it can take no more than 2 to 3 minutes. If they're asking about, why does my insurance only cover for cleaning twice a year? Who's the perfect person to answer that? That's the insurance person in the office. Just answer that really
right,
quickly. Dental assistant asking about, why do I need to floss every day? Or how do I take care of my crowns? Here, let me explain that to you. Things that they're already
right.
doing. So I'll get them, have a piece of paper or a clipboard up in the sterilization. And I said, every time someone asks you a question, I don't care if you've answered it 30 times this week, I want you to write it down because we're going to start seeing that. And those are topics for
Yeah,
those weekly videos to go through. And so, I did this experiment. I did 2 different offices. And if I have a live workshop, I show the video. The question was about crooked teeth. Why do I need to worry about crooked teeth? And both of them answered it in 2.5 minutes. One of them, 90% of the people see it die. I mean, they're just unconscious. They want to, he is so dry. He's so terrible. And he shouldn't be talking about that in his office. That's why I said, you're a wonderful dentist. You're not allowed to ever talk about this again. The other
yeah,
guy is personable. His practice is full. He's like, you got crooked teeth. Why
right.
should we do it? So that you don't track junk in there. And so we keep cavities out and you feel better. And so, these are the words he used. And this other guy used malocclusion and
Yeah,
abrasion and people went,
yep. So it's almost like, the being who you are, right? True to yourself, but bringing that personality to your kind of the communication efforts that you have online and in the practice to where you're very unique and they remember you for that. So like, for example, there's this orthodontist in Charlotte where we are, and he's, you could tell he's just a charismatic personality, right? And like, Halloween or any holiday or really any day, he's got costumes on, he's showing his office, his staff, they're just, they may be shooting a basketball in a hoop. And it's just, you can see the fun environment that they've created. And they've developed a unique, just value in the community. So when someone talks about an orthodontist, they're talking about this
he
group.
comes first in mind.
Yeah, first of mind. So to your point, that's so important. And then video is like perfect because it's engagement, right? Like people will
Right.
engage with videos because most people are scrolling on, Facebook or Instagram. And if you can show a unique video that catches their attention, they're going to engage with that more than just content that's being produced.
Well, we
So
know
it's
that because they
definitely,
slow down. We know that from scrolls. Facebook videos convert better than everyone's got these. They say, I need to hire a graphic designer. I need these little perfect graphics that we're going to post about brushing your teeth. And it's got a
yeah,
toothbrush on it. And they paid someone to do it. And it's the same stale thing. And it's nothing that's unique to their office or personal about their office. I also tell them if there's an opportunity, I like once a week for them to publish something about the community. So if there's a fundraiser that they support,
oh yeah,
give them a shout out on your page. If there's an organization you like, put a shout out. If there's a business that in your local area that you got great customer service and had great coffee that morning, put a shout out on your page because you
yep,
are in a toll booth position in your community. So, I
yeah,
know certain dentists that people would call and they, we're moving here. We were looking for a realtor. They'll ask them because they know they connected with
wow.
everybody else. So I want people to that's your job as a community leader to be there.
Yeah, be a part of the community. Because what better referrals, right? Than another business down the street that's not even in your industry is referring clients to you because you're
Right,
the go-to and they're connected with you, right?
right.
So
Restaurants, I mean, everything.
Oh yeah, oh yeah. So, I mean, you've answered some amazing, or you provided some amazing feedback and answers, and I can see your wealth of knowledge and experience. So, with to conclude, with if there's any doctor or anyone in the medical space that they love this episode and they just want to learn more about you and the services that you offer, if you would break that down into like, hey, here are my key services that will really help, in whatever environment they're in or strategies that they need, what would those be?
Well, when we look at for practices, some people just need a little bit more information. So we put out a lot of free content on our website. If you're just dabbling one and want to learn a little bit more, I put that out there for you guys. You're welcome to it. It's at gingerbratzel.com. We do workshops like tomorrow. We're recording this. So tomorrow I'm actually doing a marketing calendar workshop with some of my clients and some new people where we're going to go through and plan 2022.
Awesome.
So they have a rough estimate and what they should look at. We're going to give them some inspiration on marketing materials. They can come out and sample that. But I think the best way to, figure out what's specific for them and ask me specific questions and my team about that is, we sit down and we do a strategy session and we make those available. They can request one of those. And if we can find something to help them, I will map it out and recommend what they need. And if I can't, I got $1 million Rolodex and I can refer them to somebody else.
Nice, nice. And we love Dr. Jenner because she's an ally, right? Like you help really look at
Right.
the big picture. And so I think that's incredible. And we'll make sure we include all those resources within this episode. We thank you for your time, Dr. Ginger, and we will see you guys next time.